What we're doing here today is trying to work up some scenarios for around 2035 in terms of what the workforce in health and social care should look like, what kind of key skills, competencies will be needed for that time.
Although people have tried in the past to forecast supply and demand in the future, it's generally quite difficult. So we use scenarios so we can understand the different directions that things might go in, and we use them to test our options and strategies to see what works well across some futures or what works badly.
We need to look beyond simply 5 years because we have problems, particularly demographic changes in society, especially with comorbidities and the number of elderly people that we're going to be getting. That means we have to take a longer term view. So it's important to take that brief and look way beyond the next 2 or 3 years.
We've got people here today who are drawn from a wide range of settings within health, social care and public health. And it's a great opportunity for us to sort of come together and find out about our different perspectives, so that we can formulate our own views about our own specific sectors in relation to what everybody else is doing.
And the process that we're using in terms of scenario workshops is good. You've got the right type of people, you've got the right personalities. So the questions that are being put to those people in those small groups are causing quite a lot of spark.
Well, we're considering how people's health and social care needs are likely to change and how workforce roles need to change in order to meet those needs. So we're looking at issues such as technology and the role of technology in helping people in their own homes.
We're looking at the economy, at health outcomes, at looking at the flexible workforce and how likely that is to come about.
We're looking at the role of self-care and how that will develop. And we're looking at the role of health and social care professionals in supporting these changes over the next 20 or so years.
We've been talking about resistance to change. How can people work differently in their occupational areas, and how can we challenge silo working, which we've got at the moment? How can we get people, when we say integrated working, what exactly does that mean on a day-to-day level, and how can we get people to work more productively together?
We've got a real brains trust drilling down on these real critical issues that will enable us to have the insights to say, okay, what do we do about it? How do we change it? What do we need to change it? What are the tools we need to develop now so that we can adapt and change the workforce over the next 2 or 3 training cycles?
With what's happened since the passing of the Health and Social Care Act, there's a lot of worrying about what's happening at the moment. But I think if you don't look up and scan the horizon from time to time, you can just trudge on blindly and fall over a cliff without raising it if you don't lift your head up.
What's been surprising for me, I think, is the way that people have worked so well together. I think it's been quite positive. Even though we come from different parts of the health and social care sectors, we've all been willing to pitch in our ideas and work together and come up with some quite interesting solutions.